Have you ever pondered over what tuberculosis, commonly known as TB, really is? Let's take a moment to unmask this global health adversary. Tuberculosis is an infectious disease. It's like an unwelcome guest that primarily settles in your lungs, but it doesn't stop there. It can also move to other parts of the body, like the kidneys, spine, and even the brain. Imagine an intruder that doesn't respect boundaries. That's tuberculosis for you. But who, or rather what, is behind this disease? The culprit is a bacterium known as Mycobacterium tuberculosis. It's a tiny organism, but don't let its size fool you. This bacterium is responsible for causing TB, and it's been doing so for thousands of years, affecting countless lives along the way. Now, you might be wondering, how significant is this disease? Here's a sobering fact. Tuberculosis ranks as one of the top 10 causes of death worldwide. Yes, you heard it right, top 10. It's a formidable foe that we are up against, but here's the kicker. It's not just the sick who are at risk. Tuberculosis is an airborne disease, which means it can spread easily from person to person through tiny droplets released into the air by someone with the disease. This could happen when they cough, sneeze, or even talk. It's a silent, invisible enemy that can strike anyone, anywhere. However, it's not all doom and gloom. Despite the grim picture we've painted, it's important to remember that tuberculosis is not invincible. With timely diagnosis and proper treatment, it can be defeated. In fact, millions of people are successfully treated and cured of TB every year. So as we peel back the layers of this complex disease, remember that knowledge is power. The more we understand tuberculosis, the better equipped we are to fight it. Though a major global health problem, tuberculosis is not as invincible as it seems. We've just begun to unmask tuberculosis. Stay tuned as we delve deeper into this invisible enemy in our next scene. Ever wondered how this tiny bacteria causes such a devastating disease? Well, let's dive into the invisible enemy we know as tuberculosis, or TB for short. TB is an airborne disease. This means it can easily spread from person to person through the air. When an individual with active TB in their lungs coughs, sneezes, or even talks, they release tiny droplets containing the bacteria into the air. Anyone who inhales these droplets can potentially become infected. What's more, this bacteria is a master of disguise, often hiding in plain sight. It can live in your body without making you sick. This is known as latent TB. In fact, a quarter of the world's population is estimated to have latent TB. It's when this bacteria becomes active that it wreaks havoc, destroying lung tissue and causing the characteristic symptoms of active TB. And these symptoms are often deceptive: a persistent cough, weight loss, loss of appetite, fever, night sweats, and fatigue, all signs of TB, yet they can easily be mistaken for symptoms of other illnesses. A cough that lasts for 3 weeks or more could be a sign of TB, yet many shrug it off as just a stubborn cold. Unexplained weight loss and loss of appetite might be chalked up to stress or a busy schedule. Fever, night sweats, and fatigue could be explained away as the flu. But these seemingly innocent symptoms are a cry for help from your body, alerting you to the battle raging within. The bacteria are multiplying, consuming your health bit by bit. They can spread from the lungs to other parts of the body, causing damage wherever they go. So, if you or someone you know is experiencing these symptoms, don't ignore them. Seek medical help. Get tested, because the sooner TB is detected, the sooner treatment can begin, and the better the chances of a full recovery. Early detection is important, as TB symptoms can often be mistaken for other illnesses. So remember, when it comes to TB, it's always better to be safe than sorry. So how do we stand against this formidable foe? The answer, my friends, is through a dedicated and disciplined treatment process. This is a battle that can't be won in a day. It's a marathon, not a sprint. The primary weapon in our arsenal against tuberculosis, or TB as it's commonly known, is antibiotics. But this is not your typical week-long course of antibiotics. We're talking about a commitment of at least 6 months. Now, I know what you're thinking. 6 months sounds like a long time. And yes, it is, but let's put this into perspective. TB is a disease that can rob you of your health, your vitality, and in severe cases, even your life. In that context, 6 months doesn't seem all that long, does it? The most important thing to remember about this treatment is that you have to see it through to the end. This isn't like a book that you can put down halfway because you lost interest, or a diet you can cheat on because you're craving a slice of cake. It's a matter of life and health. If you stop taking your medication before the end of the full course, you're not just risking a relapse. you're also creating a breeding ground for drug-resistant strains of the bacteria. Imagine a version of TB that scoffs at our antibiotics, laughs in the face of our medicine. That's what drug-resistant TB is. It's harder to treat, it takes even longer, and it can be even more dangerous. That's why it's so crucial to stick with your treatment, to take your medicine every single day, even when you start to feel better. It's not going to be easy. There will be days when you forget, days when you feel like giving up, and days when you just don't feel like dealing with it. But remember what you're fighting for: your health, your life, your future. While the treatment may be long, it is a small price to pay to reclaim your health. Tuberculosis isn't just a personal battle, it's a global one. As we zoom out from the microcosm of individual struggle, we see a world united in the fight against this invisible enemy. Countries across the globe, big and small, rich and poor, are joining hands to eradicate tuberculosis. You see, the fight against tuberculosis is not just about treating the sick, it's about prevention. It's about breaking the chain of contagion. It's about ensuring that the disease does not find a new host to thrive in, and for that, we rely heavily on vaccination. Vaccines are our first line of defense. They prepare our bodies to fight off the disease should we ever come into contact with it. The BCG vaccine, for instance, has been in use for almost 100 years and has saved countless lives, but we can't stop there. Newer, more effective vaccines are being developed, bringing hope to millions. Early detection is another crucial weapon in our arsenal. The sooner we detect tuberculosis, the sooner we can start treatment and the less chance the disease has to spread. Rapid diagnostic tests are being rolled out across the world, ensuring that no case goes unnoticed. But combating tuberculosis isn't just about medicine and technology, it's about public health strategies. It's about ensuring that everyone has access to clean air and a healthy living environment. It's about educating people about the disease, its symptoms, and how it spreads. It's about breaking down the stigma that often surrounds tuberculosis, so that those affected are not afraid to seek help. And as we take these steps, we are slowly but surely turning the tide against tuberculosis. The number of cases is decreasing. The mortality rate is going down. We are, piece by piece, dismantling this global health menace. The battle is far from over, but the end is in sight. And that's because of the collective efforts of nations, healthcare professionals, and individuals like you and me. Together, we can make tuberculosis a thing of the past. We've covered a lot of ground today, so let's quickly recap. We started by unmasking tuberculosis, commonly known as TB, a contagious bacterial infection that primarily affects the lungs. We've learned that it's a silent, invisible enemy that can be spread through the air when an infected person coughs or sneezes. However, it's not invincible. We have the weapons to fight back. Early detection is key, with symptoms including persistent cough, fever, and weight loss. We then delved into the bigger picture of how TB affects our society and the importance of a community-based approach to combating this disease. Treatment is available, and it's crucial to adhere to the prescribed regimen to ensure complete recovery and prevent the development of drug-resistant strains. By staying informed about TB, we can help to reduce its spread and impact. Remember, awareness is the first step toward prevention. Stay informed, stay healthy.